Thank you again for coming.
Thank you.
Next, we have Patrick McClellan.
Hello, my name is Patrick McClellan, and thank you very much for hearing me today. I have muscular dystrophy. Mitochondrial myopathy is the exact condition. I suffer from severe muscle spasms, peripheral neuropathy, and chronic pain. I also lost my career and became totally disabled about 4 years ago. I have found that eating or vaporizing cannabis has a remarkable effect on reducing my muscle spasms and pain. I'm treated at Gillette Specialty Healthcare, and my doctors are aware of my use of cannabis and have told me that many other patients are reporting the same result. I currently take 26 pills every day, a mix of muscle relaxants, anti-seizure medications, neuropathic painkillers, and along with a high-dose vitamin therapy. I also have braces on both legs that help me walk. One of the most intense and painful symptoms of my disease is severe muscle spasms. During an attack, I am unable to walk, to eat, to use the bathroom, or to dial 911. I do receive warning signs prior to an attack, fasciculations or twitches of the muscles that will start anywhere from an hour to 30 minutes prior to an attack. During the winter of 2010, I had an attack that left me trapped between my bed and the wall for over 2.5 hours. During that time, I was unable to move and in excruciating pain. I was unable to get to the phone and forced to wait the 2.5 hours until my wife got home, and I really thought she was going to find me dead. I will never forget that 2.5 hours, and I will do anything to prevent that from happening again. I was originally not convinced that cannabis could help my symptoms because I smoked cannabis recreationally when I was not a teenager, but when I started at about in my 20s till I was about 30, and I stopped because I didn't like the high. In 2010, I did my own experiment to discover if it could relieve the symptoms and to help stop the attacks. When the warning signs of an attack arrived, I would alternate between vaporizing a small amount of cannabis or going with the two medications that I wear, emergency medications that I wear around my neck. Alprazolam and quinine are the two, so Xanax and quinine. Alprazolam and quinine are effective about 70% of the time, whereas the cannabis was effective in vaporizing 100% of the time. It was slightly less effective when I consumed it orally because of the time that it takes for it to get into my system. But it was still better and faster than alprazolam and quinine. The alprazolam and quinine I need to chew up. So I take a Xanax pill and a quinine pill and I chew them up. The Food and Drug Administration has cautioned consumers against using quinine for muscle spasms because the side effects are severe, including death. Chewing up together quinine and Xanax and quinine could kill me. Along with the high addictive nature of Xanax and the physical withdrawal symptoms, side effects actually intensify other symptoms of my disease, including the unsteadiness, slurred speech, weight gain, more muscle twitches, which make me think I'm about to have a massive attack, and sexual dysfunction. I now only use the quinine and the alprazolam when I have an attack outside of my home. When I am in my home, I will vaporize a small amount of cannabis and the attack stops immediately 100% of the time. I'm 46 years old and I have a lot more life to live, and I will do whatever is necessary to improve the quality of my life and I don't want to become a criminal in the process. And I think it's important for people to understand that the way it is currently, having to buy cannabis on the street, number one, you don't know what you're getting, But the other part of this is, if I have it in my possession and I were to like give it to somebody else, the laws are currently minimal. If I got into this program, that same thing would be severe. The consequences would be severe, which are good because I'm basically signing a contract with the state saying, thank you for doing this. Thank you for giving me safe access. And I guarantee you, I will stick with the program and not abuse the program because I know that the penalties are severe. Thank you very much for hearing my testimony. Does anyone have any questions?
Thank you, Mr. McClellan. Members, do you have any questions for the testifier? Again, thank you for coming today and sharing your experiences with us.
Thank you.
Next, I have Kim Kelsey.